My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned. Amazing Good Friday morning is a good place to be here. We thank God Almighty for the gift of life and welcome you to a Cradle to Crayon Show right here on Sunny 88.7 FM. We're live across the world on www.sunnygh.com. We say thank you to our amazing sponsors, Back Specialist Hospital and Fertility Center, and also Yashak Collection. The course of the show will open our phone lines. Don't forget you are live on Facebook at Sunny 88.7 FM Facebook page, also Cradle to Crayon Facebook page, and also on Sunny TV. We are live there. Join the discussion. Let's have a good time. Now, the joy of every expectant mother ideally is to have a baby when he or she is due and just enjoy motherhood. But unfortunately, this is not so for some expectant mothers. For some, they have their babies prematurely. The babies are born just too soon, and they are faced with spending the early weeks of their lives with intensive care whilst babies are fighting for their lives with one complications or the other. This morning I have here a neonatal nurse specialist from UGMC want to discuss premature babies. This month of November is actually a purple month where they are promoting, talking a lot about preterm babies. So want to talk more about it, caring for them when they come in, how they are feeding, kangaroo mother care and everything is as they're nurturing the babies to grow. But before they'll take a break, we'll be back.
You are all welcome to Yashak Collection. Daddies, kids, you are all welcome to Yashak Collection. Yashak Collection, we're doing all kinds of career costume, character costume, continental costume, and Santa Claus dresses for kids. We also have kids career costumes for doctors, lawyers, soldiers, pilots, police, firefighters, fire service, immigration and custom, suits, and many more. We also have accessories for all career. We also do wholesaling and retailing of graduation gowns and school cadet uniform. We are located at Carnation, close to Church of Pentecost, Central Assembly, Kaswa branch at the High Tension on the Bodrasi Road, and Kumasi Ejisu branch at NTK Plaza, Ejisu Zongo Junction. Call us on 0249 158 087 or 050 404 0443.
Yashak Collection.
One in town.
Yashak Collection.
Costumes and accessories for your swimming costumes and your goggles, cartoon character costumes, career costumes, and continental costumes. I mean, as Christmas is approaching, for the family Christmas costumes that you need for those amazing pictures, your Yashak has it in stock for your Santa costumes, for the Christmas part and plays that you do in church, for the costumes you want, Yashak will sort you out. Locate them right here in Carnation, close to Church of Pentecost, Central Assembly. In Kaswa, they are Kaswa High Tension and Bodrasi Road. And then in Kumasi, they are just Zongo Junction, NTK Plaza. Call them on 0249 158 087 or 0504 040 443. Yashak Collections, all the best. Now visit Back Specialist Hospital and Fertility Center for your fertility, maternal and general health concerns. Their services include IVF, IU, and other fertility services. There's child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care. There's also surgical service at both general surgery and plastic surgery. They do theater service and also laboratory and ultrasound scan services. Locate them right here in Accra. They are in Taifa. Or call them on 0558 862 292 or 0592 196 003. Bath Specialist Hospital and Fertility Center, integrity and excellence in health care. My guest this morning, we're discussing premature baby. She's in the person of Gloria H. Amano. She's a neonatal nurse specialist with University of Ghana Medical Center. Gloria, good morning.
Good morning.
Yes, it's good to have you here.
Yes, please.
Yes. So, preterm babies. When do we consider a baby has been born preterm?
Okay. So any baby born before 37 weeks of gestation, ideally you have to carry your baby to term up to 40 weeks. So if your baby comes before 37 weeks of gestation, we term it as preterm.
Okay. So the main determinant is the period at which they come.
Yes,
Ideally, that's how you
yes.
used to. Okay.
Determine whether the baby is preterm or not.
Okay. How small or how big do they come in terms of the weight? What are we looking at?
Okay, like 1 kilogram or 1,000 grams or 900 grams, sometimes 800 grams.
That's less than 1 kg.
Yes. So if you take a 1 kg bag of rice, the very small one, some are just like that, some are below that 1 kg bag of rice.
Is it all of them that ends up in the NICU?
Well, some babies are born 36 weeks of gestation. Their weight is fine, above 2.5. Their breathing is okay. So sometimes we keep them by their mother's side to create the bonding, and then they don't end up in NICU if everything is fine.
Okay.
But if they are born with breathing issues and other things, then they have to come to NICU for further care and management.
Okay. Usually, what's the earliest they are born and still survive in Ghana here? What's the earliest we look at?
We are looking at 28 weeks in our
28 weeks.
But
Okay.
we've been able to take care of 26 weeks and survived.
Okay. That's a boy or a girl?
Girl.
So what's it with that? They always say the girls survive and the boys don't.
I think it's inborn.
Okay.
And genetics also play a role. It's like naturally women, we are stronger when it comes to growth spects and all that. And even if you take a 12-year-old girl and a boy, you see that the girl had grown more than the boy. So we are able to withstand a lot of external environmental stresses than the men.
Okay.
So the girls tend to, in terms of statistics, the girls tend to survive more than the boys.
Okay. Now let's look at what brings them there. What is actually causing them to be born prematurely? There are times when I know mothers who do everything by the books, and then they say, your baby is coming. We have to do this. What causes this?
So there is no definite cause for preterm baby, but we have things we call risk factors that can lead to you giving birth to a preterm baby. So the first one I'll talk about is infections, and malaria infection is part of it.
That's a mother getting the infection.
Having that
Okay.
infection,
Okay.
it's able to send your uterus into spasms, which will let you go into preterm labor, and then you can deliver your baby preterm. Other things are conditions such as hypertension, diabetes, and other chronic conditions. They put you at the risk of having your baby preterm because maybe your BPs might be going to a dangerously high level, your sugars might be going so high, and then it cannot sustain life, a mother's life. So baby has to be taken out so that all the hormones will come down, and then mother will be safe, and then baby will be taken care of in the NICU.
Okay. Before our discussion, I was asking about what a neonatal nurse does. Give us a picture of what happens in a NICU. Before the baby comes in, is it like, because there's information that there's a baby coming in. Tell us, when the baby is brought in, what happens? How is the care? How is the whole process for the baby?
So when the obstetricians suspect that this baby will be born preterm, we come to the pediatric area to inform us about the birth. So we also prepare, take our equipment and everything to the birthing area. If it's the theater, we send our things to the theater. If it's the birthing center, maybe.
Oh, you join them at the theater for the delivery?
Yes, actually.
Okay.
So once baby comes out, we make sure the baby is breathing well. For a breathing baby means the baby is alive.
Definitely.
Yes. And they have issues with their lungs because it's not matured. There's a substance called surfactant which helps your lungs to expand and then maintain that expansion and closure whilst a baby is breathing. But some of them are not able to get that surfactant developing before they are born. So we have to make sure that they are breathing well their circulation, blood is circulating well, their hearts are beating well and all that. Then we transport them to the NICU.
The NICU.
Yes, on oxygen.
Okay. So in the NICU, I'm looking at the care.
Okay.
When a normal baby is on admission, maybe you are treating the baby for malaria, whatever it is, but in the NICU, it's intense.
Yes.
They are not taking your baby home because there's an issue, and there's a routine you have to do. How is it? How is it like in the NICU?
Okay. So once baby enters NICU, there are nurses also in the NICU who have prepared for the coming of the baby. If baby needs an incubator, the incubator has already been set up to the appropriate temperatures for the baby to be inside. So we just admit baby into the NICU. And most of the time, the babies who are extreme preterm, we wrap them in plastic bags just to prevent the evaporation of fluids. We don't want
That's
them
during
to
the
lose
transportation.
More, yes.
Okay.
Right from theater.
Okay.
We wrap them in plastic bags. Of course, their heads will be exposed.
Exposed, yeah, so they can
Yes,
breathe.
so that they can breathe. So we wrap them to prevent evaporation.
So that's how many
maintain
weeks?
their
I said
heat
as
also. 28 weeks and below.
and below.
Yes.
Okay. Okay. So when you
some
bring
babies can be 30 weeks but very small.
very small.
So in that case, you have to do that.
Okay.
Yes.
Okay. So when you bring them in,
Yes. So we have ventilators depending on what you are seeing. If the respirations are so bad, then baby has to be on a ventilator. Ventilator has to breathe for the baby, or we set it in such a way that when baby stops breathing, the ventilator
takes over.
so that we don't take the entire breathing process, because baby has to learn to breathe.
Yeah.
Yes.
Yeah.
So depending on what we are seeing, we set the ventilator to that. If the baby's breathing is not that bad that we need a ventilator, we do something we call a CPAP, continuous positive airway pressure, just to keep the lungs expanded so that when the baby breathes, the lung will not collapse. So we have different forms of and ways of delivering oxygen depending on what the baby needs at that time.
Okay. Okay. Okay.
So with the ventilation aspect, we make sure baby is breathing well. Then their immunity is not good. It's not mature.
Yeah.
So
Yeah.
they are at risk of so many infections. And our environment is full of infections. So we put measures in place to make sure that they are protected from infections. So we start them on antibiotics. Broad spectrum antibiotics. Then we take their blood sample to the lab and then see if there is any bacteria in the blood. If it's there, we treat. We give the appropriate antibiotic to what we are seeing in the lab results. Yeah. And then we have other medications that we give to stimulate their brain to help them to breathe. Caffeine citrate, aminophylline,
Okay.
a
A
lot
lot of
of IV fluids.
Okay.
But they will not be feeding during the first 24 hours to 48 hours, depending on what you are seeing. If baby is not breathing well, we can't feed because they are at risk of aspiration. The feed you are giving can go into the breathing area, which is already compromised. So we don't feed them if their breathing is bad. We let them be on IV fluids, which
Okay.
maintains their
Okay.
nutrition and everything.
Okay. Okay. How long have you been working with babies, like in the intensive care?
So this is my sixth year of being
Sixth
a
year.
ventilator nurse.
Okay. Okay. Over the years, what do you think has been the hardest thing for mothers whose babies are brought there because they were born prematurely?
The emotional trauma, psychological trauma, because it's not easy to have your baby in that situation. Even when your baby is born term and then there is a small issue, maybe temperatures and all that, look at the level of anxiety that parents go through, not to talk of a preterm baby who is so fragile, and every other environmental stress is affecting this baby, and baby has to be in the NICU for sometimes months. Yes, it's so stressful, and then it's expensive also. They end up depleting their
Funds, funds, yeah,
investments and
investments.
everything, just to make sure that baby is fine. So financial stress, physical stress, emotional stress, psychological stress, everything that you can think of, the parents are going through it, the family are going through it.
You mentioned that they are there for weeks. I'd always thought that let's assume a baby is born at, you had mentioned the earliest is 26 weeks. You would have to stay until baby turns ideally 37 weeks. you have to stay in there till 37 weeks or more,
At least.
at least. But it doesn't happen so. On what basis do you then discharge the baby when they come in? Because from 26 to 27, that's quite a long time. But some come in for a short while, maybe a month or two, and then you discharge. What determines that this baby is okay? He or she can go home with mother
Okay.
and all that.
Okay. So it all depends on the assessment findings.
Okay.
Now, baby should be able to gain weight adequately. So a day we are
Whilst in the
expecting,
NICU?
yes, in a day we are expecting baby to gain between 15 to 30 grams. So if baby is gaining that weight adequately, baby is able to maintain its temperature outside the incubator. So it will get to a point in the admission where we remove baby from the incubator and put in a cot
In a cot.
and
Okay.
wrap baby and see if baby will be able to maintain its temperature within the optimum levels that we want. If baby is able to do that, the vital signs, which is the temperatures, the pulse, the respiration, the SpO2s are all fine, and baby is feeding well, we expect that depending on the gestational age and the weight of the baby, we calculate the feed that baby is supposed to take. Let's say
You don't
10
just eat
meals.
keke.
No. Babies can take as little as 1 meal to start with.
1 meal.
1 meal is like
Okay.
just
The
2
small
drops,
cup.
yes,
Okay.
like some 2 or 3 drops of milk,
Okay.
just to prepare the gut, which is so immature, for it to
Okay.
get used to the feed
Okay.
before babies start feeding on larger amounts. So
Okay.
we started small, like 1 meal, then we keep increasing it little by little until baby is able to get it to eat optimum amount, like 20 mils, 30 mils in every 3 hours or every 2 hours,
Okay.
depending on baby's condition.
Okay. Okay. Well, it's just 10 minutes at top of the hour. I have here a neonatal nurse specialist from UGMC discussing premature baby. My second guest is also in. We say thank you to our sponsors, Birth Specialist Hospital and Fertility Center, and also to Yashak Collections. Our phone lines have been open number to call us 0540 130 684 0540 130 684. It's also our calling WhatsApp number. You can also drop a question, and then my guest here will answer you. My second guest is Mrs. Vanessa Bennett. She's the author of 27 Weeks of Courage and the founder of Heavenly Miracles and Angel. Vanessa, it's nice meeting you.
Nice being here. I'm so sorry for being late.
Okay, so how was your experience like? Your baby coming, how early? So 27.
Yes. my
How was it
baby
for
came
you
in.
when is a she
Yes.
when she came in early?
Scary. Scary because it was an emergency situation, and that's how she came. But then even before that, I sort of knew that I was going to have a preterm baby.
You knew.
I just yes.
Yeah, you had older kids by then, but that was your first,
She's my third.
third.
She's my third baby.
And somehow your instincts was like this baby will come before her time.
Well, because at 14 weeks I lost all the fluid,
Okay.
so
Okay.
I was advised to do a DNC. But then because she was fine, I decided to proceed with the pregnancy. So everywhere I'd gone for a second opinion, they said the baby might come earlier. So I already knew, but I was hoping that I
It wouldn't be
have,
so.
yes, because week after week things were looking okay. So I was just hoping that okay, we can get to 40 weeks, but we didn't.
Didn't get there.
Yeah, we didn't get there.
I was asking her about the hardest thing that she's seen mothers deal with. You being the mother, what was the most difficult, the challenging part of it for you, and how did you cope with it?
The most difficult part for me is not knowing. Every day I go in scared, come out even more scared out of
Oh,
my
they
mind.
didn't give you some assurance
Oh,
that
they did a good job.
a
But
good job.
I am an overthinker,
Okay.
and I like to think everything through. Know, okay, this is what it requires, and in Nico is so uncertain.
Yeah.
We don't know. So even though they are trying to assure you, they are not trying to give you so much hope that you will think that everything is fine. Okay, we are assuring you, but you know everything.
Anything can happen.
You get
Baby is
it.
fine today, tomorrow something can
Aha.
change.
So it was the uncertainty, anxiety. It was just a lot. That was the most difficult thing for me
to deal with not knowing. Like, if I go home today, I come back, especially during the season where she had apnea.
Yeah.
The not knowing was killing me.
Okay.
Yeah.
How long were you on admission?
59 days.
59 days. That's almost like 2 months. 2 months. The support, how was it for you?
So, I think the matrons, the neonatologists, the doctors, they did a great job. They did what they were supposed to do and even more. I experienced periods where the matron was on leave and she would call in more than 6 times a day just to check on my baby specifically. I'd experienced times where someone wasn't supposed to even be at work, and then around 12 a.m. they are driving to work to do
come and
something
check up
for
on
my
you.
baby. So the support was there.
It was overwhelming.
My family were there, but it's like when people don't know how it feels like, they are trying to be there for you, like especially the family aspect, but they're also asking you questions that you don't want to answer.
You don't have answers to.
So yes, it's overwhelming, but the support was there.
It was great. It was great. I want to find out, Gloria, in terms of I saw your graduation for the week celebration. How did it go?
It went so well. It was so amazing. The family were so happy to be there. So we have a group for all preterm mothers. So we announced it there. So they came in their numbers. The children were put in their graduation gowns, and then they were graduated successfully. So we graduated babies who were 1 year and above. So babies that attained 1 year, then you are good to be graduated. And then at the graduation too, we launched our Uplift Fund just to help parents who become handicapped during the process of admission, so that apart from the stresses that they go through physically, emotionally, financial aspects will not also be added to it. So it's just to support them to be able to afford the care to a larger extent.
So these were the babies who had been coming for the NICU clinic.
Yes, NICU clinic.
The NICU clinic.
Yes.
And Vanessa, how was it? Was same for you?
No,
You didn't do.
no,
Okay.
no.
Okay.
For me, finding a community or resources, people that understand, because I had to do that online.
Okay. There was no. Okay. For mothers who have been through before.
Yeah, and there's nothing like this.
But you're doing the clinic.
No.
You're going for the reviews.
Oh, yeah.
Okay. Okay. Okay.
So the follow-up that we have for the babies is what we call the
The NICU clinic.
Yes.
Okay.
So all the babies that have passed through the NICU go for review, and that's what we term as.
Do they come together?
They have 2 babies.
Okay. Okay. Okay.
That they don't all come and come together.
Together. Okay. Okay. You know, I mean, we've seen, and they're usually when the babies come in preterm, there are some challenges, difficulties that they face. What are some of the ones that ideally,
Yes. So since all their organs are not for every organ, the skin, the lungs, the liver, the brain, the eyes, you can think of it. The list goes on and on. So when it happens like that, everything is at risk of being affected with one thing or the other. Their immunity is also not matured, so infection rates are high. So we encourage mothers to wash their hands and encourage their family to also wash their hands before they touch the baby. And then they also do regular screening, eye tests, ear tests, and we enroll all the disciplines of healthcare
on
like all
board,
the health
they all come on
team are
board.
part.
Okay.
Yes, to make sure that the baby receives the holistic care that it needs. So the pulmonologist, the cardiologist, the ophthalmologist,
Everybody,
yes,
all hands on.
Yes, everybody is part of this care, just to make sure that all the organs that we know were not matured before the baby came out are all well taken care of and functioning well, so that the baby will be able to live an optimum and quality life.
Okay. Vanessa, I want to add something. You are nodding.
Oh no, for the follow-up care.
Yeah.
The things that the premature have that because their organs were not fully functioning. So my baby, for instance, we had to see a cardiologist for a period of time. Now she doesn't require that anymore.
Definitely.
We had to do audio and all that. So we had to follow up on different things for a period of time.
I have this contribution list. There's no name. It's saying my firstborn 36 weeks, 25 kg, but tripled in size by the 3rd month.
Wow.
Thank God for that. Vanessa, for mothers who are on this path, who their joy was that, oh, my baby will come at 38, 39 and I'll be done. But unfortunately, 27, 28, they say baby is coming. What word advice do you have for them?
Well, we cannot control when baby comes, but we can control what we do when baby comes. So definitely they are going to take symptoms, but you have to. It's difficult. It's going to be difficult for you, but you have to be strong. You have to keep your faith up. Those are the things that we can control. I always want to talk about the things that I can do.
You can do.
So what can I control? I can pray. I can journal to be sane. I can ask what the baby needs, what is being done, what can I do to help, so that the people around me, what can they do to help us? Okay, where do we need to go? Who do we need to see? What do we need to do? What is involved? Educate yourself, research responsibly, because on Google we find a lot of things.
A lot of information, yeah.
Yes, research responsibly, and this is what I am trying to implement with my second project, which is a brochure for preterm parents.
Okay.
Given out free throughout the to tell you how you can handle the situation that you find yourself. Because it's something that I wish that I was able to do.
Yeah.
That I didn't have to.
Yeah.
That's what made me thank you.
Okay.
It's embarking on that.
Okay. And the book, I think we'll have to make time to come and talk more. Where's it available? I guess some still have some up for sale.
Yes.
Okay.
It's available on Amazon, so you can just go on Amazon UK order, or you can order via my personal website, vanessatheasa.com.
Okay. So it's basically about your experience, how your baby came, what you had to go through. I think you had mentioned that you were discharged at a point, and then you came back you're readmitted.
Yes. So that I think I did. You see, those are the things that I didn't know, that I put in the brochure now.
Yeah.
So I thought that once we are discharged from the crew, that means that yes,
All is well.
all is well. But being discharged from the crew was like another layer of issues, because every week or 2 weeks we were in the hospital. And then whenever we go there, the comment I would hear was, "Oh, Peter for the son of with you."
Yeah, normal.
But before, I thought when we are discharged, it means that
All is well.
But we had a long journey ahead of us, and then I hadn't prepared that as before. So yes, we were admitted several times. We went in for bronchial pneumonia. We had other.
The list was endless.
So, yeah.
Gloria, I wanted to find out, when they are discharged, like she say, oh, everything is fine. What should get mothers worried? What should make them rush back and say that, hey, this is not normal?
So those are the things we call danger signs.
Danger signs.
Yes. So as the name suggests, it's dangerous. You can't stay in the house. You have to rush your baby. Baby is not breathing well. That's the first thing that I will talk about. Baby's breathing is fast. So baby should breathe between 40 to 60 cycles.
Okay.
So when you take in breath in and out, it's 1 cycle, in and out 2 cycles. So if you are counting more than 60, then it's a problem.
Okay.
And then when you observe the chest, you shouldn't be moving in and out. So it's a uniform movement. So I realize that it's actually going in. It's not a good sign. You have to bring baby to the hospital. And cyanosis also. Baby's color will be turning. Babies are pink and very nice. I realize that baby's color will be turning pale or blue. It is not a good sign. Baby is saturating, having jaundice, because the liver is not mature to be able to metabolize all the bilirubin that the blood is producing. So they sometimes build up the bilirubin and it causes jaundice. When you see jaundice, you have to rush.
You have to rush in. Our time is up already. Thank you so much, ladies, for making it. Thank you. Thank you for coming. Thank you to all those who listen, those who watch on Sunny TV, to our sponsors, back specialists, Hospital and Fertility Center, and also for Yasha Collection. Don't forget, same time tomorrow morning, there'll be a repeat podcast on Sunny TV. Have a good weekend and see you all tomorrow at the Active Square tomorrow. Bye-bye.
My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday.